Hello, welcome to Chapter 1, Veterinary Healthcare Team Members. This material should be a review from VET 101. We will go over the various positions within a veterinary practice, including job duties, why a team environment is necessary, and what organizations are important to all veterinary teams. A team mentality is essential when working with animals. Open communication allows for better health care for your patient, better service for your clients, and a better work culture for those in your practice. In your book, we learn that clients expect better customer service from their veterinary practice than from their own healthcare provider. Being able to share in new ideas or products or get behind a new hospital initiative will help you feel more connected to the team. A large part of being in a medical setting is being able to communicate to clients about their pet's health. By communicating with your team members, you can better express concerns. A veterinary clinic is full of workplace hazards. Making sure that you can explain a procedure or train another team member is part of being on a team. All employees in a veterinary clinic rely on each other to provide a safe work environment. We are going to talk about each of these team members and the roles they play in the veterinary clinic. As a member of the veterinary program, you will complete several internships. You may have fellow classmates at your internship sites. Sometimes there are veterinary assistant students or veterinary students there as well. It is important that you communicate to a student as another team member. Many internship sites use an internship as a working interview. Some internship sites may also be a reference for you for another clinic. Try and have the mindset that the veterinary community is a small world and that you may work with people at your internship clinics in the future. Groomers are essential to the veterinary health team. Not only do they provide baths and haircuts to our patients, they can often find health issues before the owner is aware of them. Communicating with an on-site groomer at your practice is a great way to get patients in for missed ear infections, anal gland issues, or lumps and bumps. Groomers foster the human-animal bond by making both the client and the pet feel good, and it is important to continue that with the rest of the vet care team. Kennel assistants are often veterinary assistants or future technicians in disguise. Typically, the kennel tech is trained to care for the patients boarding at the facility and for the facility itself. While they clean, they also may be trained in animal behavior and restraint. It is important, especially with weekend or holiday kennel staff, that they recognize emergency situations and communicate to the veterinarian on call. Kennel techs also need to be able to follow instructions, for example, food directions and medicine administration. Veterinary assistants may have on-the-job training or have completed a training program. The National Association of Veterinary Technicians in America, or NAVTA, has standards in a national exam that a veterinary assistant can complete. An assistant's duties may vary per state. Restraining patients is extremely important for both assistants and technicians to master. As stated in your book, trained assistants can be vital for a credentialed veterinary technician. An assistant can complete laboratory orders, care for patients, and talk to clients, which helps lighten the workload for veterinary technicians and for veterinarians. Veterinary technicians are considered credentialed when they graduate from a 2-year veterinary program approved by the AVMA or American Veterinary Medical Association. After graduation, a veterinary technician must pass a state board as well as the national exam provided by the VTNE or Veterinary Technician National Examination Committee. Once the exams are passed, a veterinary technician then becomes credentialed, licensed, or registered. This depends on the state that the veterinary technician is in. Depending on the state, the veterinary technician can complete certain duties. Typically, these include all of the skills that a kennel or veterinary assistant can do, as well as performing exams, giving injections and vaccines, placing IV catheters, communicating with clients about diseases and illnesses, calculating drug doses, completing laboratory procedures, performing dental cleanings, monitoring patients under anesthesia, taking radiographs and performing ultrasounds, and the list continues. Most veterinary technicians are required to complete continuing education to keep in good standing with their state veterinary board. A veterinary technologist may have a 4-year degree from an AVMA accredited program, or they may hold a bachelor's degree in an area like management and also have a 2-year associate's degree in veterinary technology. They typically work in academia or research settings. They may oversee a veterinary clinic, provide training, or maintain a hospital's inventory or protocols and procedures. A veterinary technician specialist has gone through the same process as a veterinary technician, but has decided to focus on a specific area of veterinary medicine. Since the publishing of the textbook, there are now 16 specialty academies and 6 societies recognized by NAVTA. To be a VTS, or veterinary technician specialist, you typically need a combination of years of experience, hours within the specialty, case studies, and skill sign-offs from other specialists or veterinarians. Receptionists are known as the face of the veterinary practice. They are often who the client interacts with first, either over the phone or in person. Many assistants and technicians may work as receptionists. Client communication and education is vital. Being able to handle multiple tasks, perform transactions, and understand medical records is key. Office managers generally oversee customer service and train receptionists in public relations. They may complete administrative tasks like accounts receivable, invoices, and bank deposits. Some office managers also double as veterinary assistants or veterinary technicians. Veterinarians can diagnose, prescribe medications, and perform surgery. They also go to an AVMA accredited school and pass a national and state board. Veterinarians are also required to complete a certain amount of continuing education or CE per year to keep in good standing with their veterinary board. Some veterinarians are board certified and specialize in a certain area of veterinary medicine. Some veterinarians in their practices belong to AAHA, or American Animal Hospital Association. This organization has guidelines and protocols that help standardize the industry and provide a benchmark for veterinary clinics. Practice managers are typically in charge of any human resource needs. They train staff members, review hospital records, manage client relations and marketing. Some practice managers are associated with the Veterinary Hospital Managers Association, or VHMA, and are certified veterinary practice managers, CVPMs. Hospital administrators oversee all aspects of the veterinary practice. They are sometimes veterinarians, technicians, or business managers. They operate areas of the business as well as the practice of the medicine. They make the financial decisions of the hospital and sometimes have an influence on hospital protocols. Training is important for any organization. In veterinary medicine, some staff members, like technicians and veterinarians, require continuing education to keep their license. VSPN, or the Veterinary Support Personnel Network, hosts online communities like the Veterinary Information Network, or VIN, that connects veterinarians from around the world. VeterinaryPartner.com is an offshoot of this community and provides veterinary-reviewed information for clients. ACT, or Animal Care Technology, videos can be used in clinics as well as veterinary assisting and technology programs to go over specific protocols or procedures. Most state veterinary boards also give continuing education seminars. Veterinary manufacturers and distributors do lunch and learns to provide information about new products to clinics. Overall, team members must be knowledgeable in their roles and able to communicate effectively to provide the best care to their patients. Good teamwork provides a safe, enjoyable work environment. Clients value veterinary practices that work well together. Practices thrive under work cultures where teamwork is valued and employee turnover is low. And that concludes our lecture for Chapter 1.